Thank you so much. Thank you so much. I am really glad. And thanks, Dr. Bansi, for organizing this excellent conference. So, I shall be talking on can diabetes epidemic in Asia be prevented? See, this is the numbers and why they matter because 1 in 11 adults are living with diabetes. So, the huge burden on healthcare. The number of adults with diabetes is expected to reach 113 million by 2030 and 151 millions by 2045. And obviously, this is transitioning younger population. Over 1 in 2 adults living with diabetes are undiagnosed. So we need to have the awareness and education. 747,000 deaths caused by diabetes in 2021. I mean, obviously because of various complications and mortality is occurring at a younger age group. $10 billion are spent in diabetes in 2021 out of pocket economic cost. So why I said that these numbers really do they matter. Now why India matters? Because India currently has the largest population in the world with 1.44 billion people, which represents 70% of all South Asians. South Asians share common genetic, environmental, socio-culture, and lifestyle factors that contribute to similar disease pattern. India thus serves as a microcosm of South Asia for understanding the health trends in this region. Whatever was here will probably work elsewhere, hopefully. This is the characteristic South Asian phenotype. The lower age at the onset of type 2 diabetes, hyperinsulinemia characterized by increased serum insulin levels and insulin resistance initially, followed by a rapid decline in beta cell function and severe insulinopenia, that is insulin deficiency, later on. Lower BMI but excess ectopic fat, particularly in the liver and abdominal, is again the characteristic of South Asian people. Low birth weight, classically described by thin fat Indians. We have got low muscle mass. Then other characteristics dyslipidemia, that is decreased HDL cholesterol, increased triglyceride, and increase in the small dense LDL cholesterol. We have got decreased levels of adiponectin. Further, we have got increase in the inflammatory markers, particularly hsCRP, increase NFLD, and gut microbiota dysbiosis. These are the characteristic phenotype of South Asian people. The rising trends of diabetes in Asia, the common factors are obviously genetics, younger age diagnosis, rapid transition from the pre-diabetes to diabetes, increasing prevalence of GDM, Dr. Seita Vajay has already mentioned. Treatment access, traditional treatment still take precedence, declining physical activity levels with overnutrition, and I'll say mobileization, that is again what is happening in the South Asian people. The ICMR India study, that was the largest epidemiological survey on diabetes in India over 12 years, based on the sample of 124,000 individuals covering in all 31 states and union territories, 101 million people with diabetes, 11.4%, 136 million people with pre-diabetes, 15 to 3%. This is very important because if you don't interfere, if you don't intervene at the pre-diabetes stage, almost 40% will convert to diabetes within 4 years. Younger population, age 25 to 34 years, there is rising in the prevalence of diabetes, which is occurring at much lower BMI and associated so many metabolic conditions or comorbid conditions at presentation. The reason for increasing prevalence, as I already mentioned, that we have got genetics susceptible to plus intrauterine programming because we have got the mother has got low vitamin B12 and high folate levels. That is probably one of the reasons why genetic factors are playing a crucial role in increasing the prevalence of the disease. And this low vitamin B12 and high folate levels increase susceptibility to type 2 diabetes from the birth, overnutrition during childhood, adulthood, and because of the excess refined carbohydrate intake, low protein and fiber intake, exercise, excess fat and adiposity, and that is the characteristic, and obviously that is give rise to small adipocyte fat overflow hypothesis. Fat overflow hypothesis means that when you have got the excess fat deposition, this fat is going to be deposited ectopically, maybe in the abdominal, around the cardiac, or in the liver. So that is the fat overflow hypothesis. Then we have got ectopic fat, particularly the subcutaneous and visceral and liver fat deposition, air pollution, hyperinsulinemia. Air pollution also give, I will show you one or two slides. The air pollution give rise to hyperinsulinemia, insulin resistance, and rapid beta cell failure. And ultimately, we have got the characteristic features of what you call it South Asian phenotype of type 2 diabetes. So, if you see in the pathogenesis, what I have mentioned is for modifiable and non-modifiable factors, and on the left side you can see all the points that have been mentioned. I have already highlighted. The question arises: what is the solution? Obviously, the solution is improved nutrition in the mother, pre-pregnancy and intrauterine period, and particularly ensure the adequate intake of vitamin B12 and decrease in the folate intake, particularly among the vegetarian people. The B12 deficiency is quite common. From childhood, modify lifestyle that you have to see right from the beginning. You must insist reduction in the carbohydrate intake to the child, increase the protein and healthy fats, increase the fiber, increase exercise, particularly advise some form of the resistance training exercise, maybe stretching exercise or the simple walk or the yogas and other things are there. And obviously, it's not in much our hand, but you can avoid that if you somehow reduce the air pollution, that is will also be helpful in the prevention of type 2 diabetes in the South Asian people. So this is the what are non-modifiable factors I have just mentioned. There are some things, but there are many factors you can modify and you can do for the prevention of this disease. Now the question arises, is it possible to prevent or modify diabetes epidemic? Obviously, the successful prevention of any disease requires several essential prerequisites, and these are age, diagnostic criteria. Yes, we have to have the agreed diagnostic criteria globally and everywhere. Knowledge about the risk factors. Obviously, if you are able to deliver or educate the people that these are the risk factors, they are going to probably prevent or decrease the incidence of diabetes epidemic. Natural history of the disease, yes, again you can modify the natural history either by improving the nutrition, the correct diet, lifestyle modification. You can also modify the natural history of disease. Affordable and acceptable screening method to identify the high risk individuals. Obviously, we have to have the simple screening method, simple, we should be able to you should be able to reach everybody. The person should be able to afford it. Probably also this is going to help because if once you are able to diagnose and identify the risk factors, this is also going to help us in preventing or decreasing the disease epidemic. We have to have acceptable and efficient methods to influence modify these factors. This is also going to be helpful in preventing or decreasing the incidence of type 2 diabetes. You must design, or you must be able to design the proof of concept trials to demonstrate the effect of intervention on the risk reduction in the high risk people. This also can be done by simply educating the masses and applying a correct methodology to deal with these factors. We have to have the successful interventions to develop prevention policies. This also is possible, but obviously it involves the lot of our people, the political people, their will, and all of them, they are going to play a crucial role. So you must able to identify the high risk group. Screening programs should be practical, applicable to in any setting. Screen at an early age, less than 30 years, we have said recently about a year back, now this screening, particularly in the Asia, now should be less than 20 years, and particularly if the person has got family history of diabetes, or if the person has got a history of GDM or PCOS, it is better to screen at less than 20 years, because we are getting many cases of type 2 diabetes even at the age of 18 or 19 years, and particularly they have got because of the lifestyle changes and the obesity. If you are able to screen at early date, this is also going to be helpful. The low birth weight already has been mentioned, and how it is playing a crucial role in the prevalence of this disease. I'm sure you are aware of various diabetes prevention programs. I'm not going to detail. We have got some of the diabetes prevention program in India also. And overall, if you see all these preventive program, still you can say it is the lifestyle modification which is superior to any form of intervention by the pharmaceutical drugs to prevent diabetes. And the same is true in India also. So we have got the summary of main results from the various major proof of concept randomized trial to prevent type 2 diabetes in high risk people lifestyle intervention, which I am sure already mentioned that lifestyle intervention is the most common strategy to prevent and decrease the prevalence of this disease. Physical activity, some is better than none, more is better, and earlier is the best. So you have to stress about the physical activity. Commonly it is recommended 150 minutes of moderate to vigorous physical activity per week, while aerobic or resistance training or both. 20-minute brisk walk reduces the risk of developing type 2 diabetes by almost 30%. And if you are able to walk 30 minutes walk covering 3 kilometers in 30-35 minutes, you can reduce the prevalence of diabetes by 50%. Increased glucose uptake and oxidation in lean tissue such as skeletal muscle and liver release the pressure on adipose tissue for unused energy storage, improve the adipose tissue storage capacity and thermogenesis, which are all factors that contribute to type 2 diabetes risk reduction. Metabolic improvement associated with more physical activity are important factors for preventing this particular disease. So there are various physical types of activities. You all know that how the population-based solution to promote diet physical activity, and you have to target the health challenges, environmental system barriers to these people, and you know that how physical activity is going to improve the cardiometabolic effect of engaging in daily physical activities, lowering the risk of age-associated health complications, whether it is neurodegenerative diseases, decrease the ischemic stroke, respiratory disease, decrease the ischemic heart disease, non-alcoholic fatty liver disease, and same is true for type 2 diabetes also. Reduction of carb. This is very important because we love carb like anything. Reduction of carb is related to decreased type 2 diabetes prevalence. You know, the case has already shown that there is a strong association of total carbohydrate intake, glycemic load, and glycemic index with prevalence of type 2 diabetes. Dietary fiber showed a protective effect. Prospective urban-rural epidemiology, the Pure study, has already published that higher white rice consumption significantly increases the risk of developing incidence of type 2 diabetes. A 10% reduction in carbohydrate intake, if replaced with the protein, preferably plant-based, along with the increased fiber and healthy fat, could potentially postpone type 2 diabetes. Ultra-processed food, again, is quite loved by the younger generation particularly. We know that the high energy density sugar, trans fat as well as additives, the ultra-processed food are responsible for more than 50% of daily total energy intake in high-income countries. Systemic review of 7 prospective cohort studies are already shown relative risk reduction of 1.5. In a meta-analysis, the same authors found that each 10% increment in total ultra-processed food intake was associated with 12% higher risk on type 2 diabetes. Low age diet exhibits improvement in insulin sensitivity and reduction in the inflammatory levels compared to the high age diet. I know that if you are able to consume or if you are consuming low high dietary advanced glycation end product based on diets and oral disposition index, and this was a study that was 12 weeks history published, showed that the significant benefit is there in the reduction of the disease. A word about air pollution and type 2 diabetes. The meta-analysis of five prospective cohort studies from Denmark, Canada, and USA reported a pooled relative risk of 1.1 for developing type 2 diabetes per 10 microgram per cubic meter change in the average PM 2.5 exposure. You can imagine how much PM2 we are carrying in this various city of this country. So recently it has been shown that there is some linkage with the uh, air pollution with the prevalence of type 2 diabetes, but however it has to be further studied and confirmed. I have not mentioned, the slide was already shown by Dr. Saita Bajaj, that the pregnancy is an opportunity to prevent type 2 diabetes, and she has already mentioned the values of pre-conception counseling, the first trimester, second trimester, and postpartum counseling, and how they are going to reduce the risk of type 2 diabetes and other non-communicable diseases. Just to summarize, diabetes is a preventable disease, requires multi-level coordination, information on the health consequences of type 2 diabetes, and measures at the appropriate government level to protect all persons from exposure to the risk factor for type 2 diabetes. We have got the robust evidence from randomized controlled trials regarding alteration of the progression of diabetes epidemic. Diet and lifestyle changes go a long way in making things simpler and easier, and the participation of civil society is essential in achieving the objective of the treaty. Thank you so much.